For sure. All right. Well, it is 9:01. I'm going to dive in. Welcome, everybody. Happy Sunday. Hopefully, I'm going to be another one of those annoying people that say, hopefully, you're staying safe in these crazy times. But yes, definitely hope you're staying healthy and staying active for sure. But today, for those of you, I know I do have some people that referred friends and whatnot. So I just wanted to take 2 seconds to introduce myself, tell you where we're going to try to direct this webinar this morning, and give you some housekeeping tools for you to get the most out of today. So I'm Diane Flores. I am a personal trainer. I've been working with women for over a decade, and I'm also a nutrition coach. I do a whole host of the things. I have a competition team, and I'm an IFBB pro now. I can't even say it because it's weird to say out loud. And my passion is really helping women find their unique way to live a healthy and balanced lifestyle that eventually will guide them down the right path for health and longevity for forever, right? For as long as they're going to live, but in the most graceful way possible, amongst other things. And working with women for over a decade, I have tend to see the same trends that come up in their nutrition and struggles. And I've been working with Dr. Sundermeyer closely, referring a lot of my clients. Obviously, there's certain things that are out of my scope of practice when it comes to being a health coach. And seeing the struggles that women are facing, I definitely wanted to get an expert on, because I know when I work with my nutrition clients and I tell them like, hey, this and this is possibly going on, they're like, yeah, you're not a doctor, it's whatever. So it's great to have the resource to say, this is a specialist in this field, and she can definitely help you dive into, some further things that might be going on, because a lot of times there's things we can't see. So with that being said, I brought on Dr. Sundermeyer here, and I'm going to let her introduce herself real quick, give us, sort of your background as far as hormonal health. And then I have a list of questions that I would love to just start with. My goal is that this feels very conversational, right? So imagine you had a best girlfriend who was a doc in, hormones, and you want to know all the things. This is the opportunity to do so. So somewhere on your screen, whether you're watching from mobile or desktop, there should be like a little chat box for those of you that are watching today. If you have any questions at all throughout our conversation, something that comes up and you're like, ooh, but what about this? Chime in there. If it's something you're like, I don't want to be like that one girl that raises her hand and sounds dumb in the classroom, then send it to me privately, and I will keep you anonymous and I will ask her for you.
Okay, let me pull up my chat box.
Okay. And then, I think from there we will just riff. I'm going to continue to allow all these folks in, but Dr. Sundermeyer, go ahead and take the floor. Let us know a little bit about you and why we need to know all these things.
No pressure. Well, good morning, everyone, and happy Sunday. My name is Dr. Sundermeyer. I am an integrative doctor, actually specially trained as a naturopathic doctor. And basically I always say for that, it means I walk the line between conventional medicine and integrative medicine. I am not just a full-on holistic doctor, and I am not your conventional MD. So, I was trained in the conventional world, and I was also trained in herbal medicine, hormone therapy, digestive health, and just looking at things in a little bit of a different perspective, which I think has given me a lot of really good leeway to look at people in a bit of a different direction than your conventional doctor does when you go in just for your basic wellness exams. We really appreciate what they do, and they have their purpose, but then there's always that lack in those limitations that they have. You go in and, you're feeling tired. You go in and you feel like your thyroid is off or your hair is falling out, and, they run the basic panel on you and their labs, your labs are perfect. And a lot of the times the issue is, of course, is that they're not perfect, but they're just not looking at the right avenue of things. And that's kind of what's guided me down this road. So in about, 2014, I took my first training in just conventional, like just focusing in hormone therapy. And it's kind of just been spawning from there, where I've been solely now focusing for the last 5 years, basically, on hormones themselves when I opened a clinic in Turlock, actually. And so I've basically been working with women from 10 to 80, helping with hormone balance and helping with estrogen dominance and helping with people trying to understand why the week before their period, they become a new person or a different person, or they can't stand their family. And it's kind of gone from there. And a lot of the complaints I get is women in their late 30s, 40s that cannot lose weight, and they cannot figure out why. And, so our goal is almost like an investigation detective, where we have to determine, well, you sound like you're adrenal fatigue, but could it be thyroid caused by adrenal fatigue, or is it thyroid that's affecting the adrenal, and where's your estrogen lying? And so estrogen, I think, plays such a huge role, more than we think. I think a lot of us think estrogen is such a bad thing, and really it's just all about this balance that not a lot of people take into consideration as to the day-to-day things that can affect estrogen, like alcohol, for instance, like we talked about a moment ago. And the biggest issue is how estrogen is produced, but how it also leaves the body. And nobody takes enough consideration as far as how it leaves. So that's kind of where I focus on, is natural detoxification, how to kind of let your processes work properly and then rebalance as needed. So, that's kind of my.
I love it. I love it. So since that came up, and that is something that I definitely, I try not to be a dictatorship with my clients on their nutrition, because I come from such a hardcore, the extreme of dieting, right? And they're like, well, what do you do? And I'm like, that's not normal. That's very not normal. But let's try to find a middle balance. And I think when I was a nutrition coach really early on, I was hardcore and I was like, no alcohol, you got to eat broccoli and chicken 6 meals a day. And then I'm working with clients, and then realizing as I age, as my clients age with me, that's absolutely not realistic. And I try to steer people away from that now, is the conversation around alcohol, and working with a lot of women and getting them to understand. I'm not telling you, you should probably restrict to 2 drinks a week because I'm trying to be some dictator. I really know the health implications and how hard it becomes to lose weight, how it affects your hormones, how it affects your mood, all those things. So just so I have backup, can you elaborate a little more on how alcohol affects, our hormones and things as we age, and just in general overall fat loss?
Well, the biggest issue with alcohol is it affects the way the liver functions. And the second you affect the way the liver function, you affect everything in the bodies in its natural detoxification. And so because alcohol will be a priority over detoxifying, say, estradiol, which is one of our primary female hormones, right? And so that is actually a bigger issue over time, is that's where we tend to know a little bit more weight gain, is because our body's attempting detoxification of the more poisonous thing. And so estrogen, again, it gets put back on the back burner, for instance. So there's just a little bit too much strain going on in the liver. And then over time, it actually can hinder estrogen and decrease its production and cause things like hot flashes in the middle of the night, where a lot of women will get night sweats, say 2 to 4 a.m. And they think it's estrogen, and really it's alcohol. And that's actually my favorite one, is that, we tell them, just give yourself a couple weeks off, see how your hormones change. And sure enough, finally, estrogen has been able to metabolize a little bit better. The production is able to balance itself out a little bit more. And then all of a sudden, the body feels so much better. So it's actually, it affects it in a couple different routes. But for simplest states, it messes with your liver just way too much. And so nothing else can really work properly.
It's prioritized. Yeah.
It's prioritized. Absolutely. And the bad thing is it's prioritized over a lot of other things. Not only is it going to affect estrogen, but it's going to affect your cortisol hormone as well. So it's going to affect that stress response more and more.
Okay. And I think this is a good, actually, speaking of cortisol, is, getting, breaking it down in I think it's demonized as cortisol is the nasty hormone, when the reality of it is that we need cortisol and, to function properly. However, when it's out of balance, that's when it becomes an issue. And so I'm trying to also work with clients in understanding that and giving them some supplementation and some other cues lifestyle wise to help with their cortisol balance. But can you touch on that as well, as far as cortisol and how it relates to female hormones?
Well, absolutely. So cortisol is actually an essential hormone. It's one that will take priority over your progesterone, your estradiol, your testosterone production. So it's basically necessary for life. Hold on. So Jessica just asked a question. Sorry, I got to start looking at the chats.
That's okay. I have my eyes on it too.
Okay,
so
perfect.
Good. Yeah.
But let me finish with cortisol and then I can answer that one.
Totally.
So with cortisol, it's actually going to be prioritized over any of the female hormones that are located in the adrenal gland. So there's two big pathways that we talk about. It's a glucocorticoid pathway, which is a very fancy way for saying making cortisol, and then the androgen pathway, which makes DHEA, testosterone, and then in turn estradiol. And it's actually needed for our natural circadian rhythm. I mean, do you remember when you woke up feeling bright and refreshed? Well, that was your cortisol actually waking you up, starting for the day. So the sunlight is actually a big initiator of cortisol. And a part of encouraging our natural circadian rhythm is to encourage people to open up their blinds in the morning and get some natural sunlight, because it actually starts encouraging your own cortisol production a little bit more effectively. So it's our natural circadian rhythm with melatonin. So it's essential. We want to wake up feeling refreshed. We want to wake up feeling like our brain works. We want to feel like we are on top of the world, right? And can make it through the day. So that's actually cortisol. When cortisol becomes bad is when we use it too much. It's always been meant to help us make it through the day as our natural circadian rhythm, but it used to just be there in a stress response, what we call a sympathetic state or flight or fight, when we came upon a bear. Bears are always my biggest example, because I think we all think if we saw a bear, that would just be scary. But that's where our cortisol response comes into play. Other times we've all experienced it once or twice, where we've had a car accident or we've almost been in an accident and we get that jittery rundown. All of a sudden we feel like our body is a bit shaky. That's actually your cortisol responding and making adrenaline or epinephrine and making you basically ready to respond to whatever action is about to take place. But the issue today with cortisol is that we are literally expressing fight or flight responses daily now. We're either stuck in traffic, we drive the Altamont daily or multiple times a week to get to work. Unfortunately, we've worked out way too hard for way too long and have never really appropriately rested, or we didn't feed our bodies effectively. We are lawyers or doctors or teachers that work 12-hour days. And so it affects people really differently. And then there's the opposite case where you might have just had a lot more, repetitive illness when you were younger, because your cortisol also responds to your immune function. So cortisol will actually, people will realize that as they've gotten older, their allergies have gotten worse. Or, and that's actually because your adrenal gland slowly over time is becoming more fatigued. And so it can't control your natural immune response. So it has way too many functions in our body, even probably to talk about today, but those are some of the major ones. And that's really where we have to consider it as a part of our day-to-day life.
Right. And so, and I see this all the time. I work with a lot of women in the health space. So I have a lot of nurses, I have a lot of counselors, therapists, et cetera. Or I think something that maybe isn't discussed as well is being in home situations or relationship situations or things of that nature that are constantly triggering, and you're living. And I know, just from experience, the same thing of that also having an effect as well.
Absolutely. Because if there's constant emotional anger, frustration, irritability, or other situations, I mean, that is going to ignite, think of that car accident statement, it's igniting a response in your body. How do I defend? How do I make sure that this doesn't escalate? How do I make sure this or that doesn't happen? And so I actually have a woman in her 40s now, but basically she she'd been dealing with physical and mental abuse, emotional abuse since she was 4. She could think back, and she couldn't figure out why she'd been exhausted for the last 10 years, and nothing she could do worked, and her thyroid was worked on, and it was okay, but not great. Like when we met about a year ago, and I was like, well, let's talk a little bit about your life. Tell me what things. And we talked about the adrenal gland specifically. And she was like, well, would this impact it? And she basically told me a brief of what, her childhood was like. And I was like, so basically you've been dealing with fear and fear, responding to cortisol since you were 4, from what you can remember, basically. And so that's basically led her into adrenal fatigue. And the different stages of adrenal fatigue are based on labs, but it's like we can kind of speculate what they are, but the labs, tell us kind of exactly how to place you. But yeah, so emotional is probably a bigger issue as well, that requires multiple applications of support, but it's definitely affects not just cortisol, but the whole system.
Yes. And so with that being said, so I know we just had a bunch of new faces join in. We're talking about cortisol and how it relates to, female hormones and fat loss, et cetera. But also expressing the importance of when this is a primary issue, what are the side effects that women will experience? So if your cortisol is like through the roof and it's doing all of the fancy things that it's not supposed to do, what would a female be experiencing, like symptom wise? So if you're experiencing this, it could possibly, I know that's super broad spectrum, but in your experience.
Well, there's stage 1 is kind of like, we always say we live our 20s and 30s in stage 1, where we feel like we can sleep 4 hours, work a 12-hour shift, and we feel great, and we can still hang out with our friends every weekend and go out, right? That's living in that fight or flight state. The issue is eventually that comes to an end, and it can actually lead to anxiety over time. So just think about constantly almost being in an accident. You're always on alert. You're always easily overwhelmed. And you actually start noticing little things like a pencil dropped, or your husband clapped, or your husband startled you, and your startle reflex is actually off the chart. So when you start noticing that easy startle, you know that you're hitting that lovely high. The biggest issue is that repetitive cortisol response due to a stressor, right? And that's always the worst word, because stress is such an umbrella term. And, when I was in med school, one of the people that I had a rotation with was like, what does stress mean? What does it mean to them? And I was like, I don't know. She said she's stressed. And so, you have to learn what that means to people. But it signals adrenaline. And every time adrenaline signals, your body is naturally thought to release glucose. And so how many times a day are you releasing adrenaline and then in turn glucose? And how many times is it that you're sitting at a table or a desk, or you're driving in your car? And so glucose is floating around going, all right, well, all these muscles are fed. The heart is good to go. So now I need to be placed, because glucose has one purpose, right? Feed the cells or make fat. And so all the cells are fed. And so now we make fat tissue, and that's where we get those lovely love handles and abdominal pouch. And it seems to always love that area. I have some women that get it in their buttocks and their thighs, but it's always that central obesity, we like to call it, or central fat gain. And that's where it's more cortisol, is when it sticks to that generalized area. And there's nothing you can do to get it off, because that's always the hardest place to lose it too.
Right.
Which is super fun. And that's where that cortisol is a part of your culprit. And I think with the cortisol, as we move into stage 2, you have to think thyroid issues, hair loss, cognitive changes, fatigue. I get that 3 p.m. afternoon energy drop every day. How many of you have that? I work with people that have that all the time, and that's just a part of your natural curve. And instead of your curve waking you up nicely and coming down calmly, it basically is plummeting around 3. And so that's kind of where we say, I have so many people that come in and go, my thyroid is off. And I'm like, I bet you it's not thyroid. I bet you it's cortisol. And about 80% of the time, it's your adrenal gland over your thyroid. Although we do take a very good look at that as well.
Yeah, I know, I work with a lot of online nutrition coaching clients. And
Mhm.
when they check in with me, one of the questions in there is, how are your stress levels? I ask a multitude of questions, of which people are probably like, what is this related to my diet? And I'm like, there is a lot. It's
Yeah.
not just like calories in, calories out, especially for women over 40. I want to know, are you pooping? How much are you sleeping? What are your stress levels?
Absolutely.
All the things. And so, when I'm asking that, it's more of, just to offer some lifestyle guidance or some tips, or like, how can we minimize the stress in your
Mhm.
life? And I think as women, I'm speaking as a whole, at least from my experience with working with women, it's like, we just want to like, go, 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 do, like
Mhm.
put ourselves like, here's the stove, I'm on the back burner, everything else is here. And,
Absolutely.
why am I not losing weight? Why can't I sleep? Why, all these things.
Mhm.
And I try to help them rearrange slowly, like, let's bring you to the middle burner. And then we're
Yep.
going to, here. And it feels very like self-indulgent to just say like, oh, I need to have, some self-care, which I know is very loosely used, but, or how can we eliminate that stress? And let's talk about reverse engineering that. Like, what does that look
Right.
like? So, there's like some, management expectation and also some lifestyle coaching that goes on, because I know that down the line, it's also going to help them get to that greater goal when they are trying
Mhm.
to work on fat loss, for sure.
Absolutely. No, and I think that's the bigger issue more than anything is that they've spent the last 40 years putting everybody first,
Hmm.
and their kids are first, and their kids are in sports, and their husband works all day, or, and I think, a lot of the time stay-at-home moms kind of get the raw end of the deal. And I'm like, yeah, I think you should just go back to work.
Yeah.
Because it's
Yeah.
about, my priorities are not just one thing. Like, if I had to work and manage my house, and I don't have kids at this point, but if I had kids, I would probably just come home and pass out every day.
Hmm. Hmm.
So I can't imagine just the things that some people tell me. And I'm just like, okay, well, now we know why you're stressed. You've just told
Hmm.
me why. And then it's kind of like, eventually we need that light bulb to go off for
Yeah.
people. It's about, well, this is just my life. And the thing that always frustrates me with patients in this, I'm sure you've heard this, is just like, well, I don't know what my energy is because I just have to push through it. Like, I have no
Yeah.
choice. And I'm like,
Hmm.
well, let's try and step back and figure out, well, what do you have a choice in? And
Hmm.
I think that's always the first thing. Like, where can you get help? Where can you get support with either family or, your significant other, and really try and create better balance so that it's not
Hmm.
just you in this pathway. Because if you keep moving down this pathway, that's where stage 3 comes into play. And we call that your flat line. And it's as dramatic, I would say, as the movies make it, where it's like beep, 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 and then you just kind
Yeah.
of flatline. And that's like just total exhaustion. I can
Hmm.
barely get up in the day. I can barely make it through the day. I can't think. My brain is, my memory is shot, all of that. And so I think that's obviously really important to take note in, because eventually, if you don't give a little bit back to yourself, you're not going to be able to give to anybody. And I meet people in that state too. And I was like, well, how long have you been in this? And, it happened. And the biggest issue, I would say, now that I think about this, is it happens suddenly. You
Hmm.
just got sick, you got the flu, and ever since the flu, you haven't been able to recover. You got in a car accident, ever since that big car accident, or even if it was minor, you haven't been able to recover, and now you can't function. And so it actually, stage 2 to stage 3 can happen suddenly and not just slowly like some people experience it, because it can happen after a huge response to stress, whether it's car accident, illness, your family member died suddenly or
Hmm.
tragically, or just it was bound to happen, but you haven't been able to resolve the grief. And ever since then, I haven't been able to do these things. And
Hmm.
that's the one issue, that if you don't take a little bit more priority back into yourself and do that, then you're kind of in that place where, well, now you have no choice but to focus on yourself, because your family can't get any of you. So
Correct. Correct. So, real quick, for those of you that have any, I think since we're on this topic, if you have any questions about cortisol,
mm-hmm,
actually, Diana posed a really good question that I was going to
mm-hmm,
actually ask you anyhow, was obviously aside from lifestyle factors, which I feel personally should be the first attack of defense, at least, is managing that
mm-hmm,
stress response, like where that's stemming from. But
mm-hmm,
anything that you would suggest, I know there are some supplements that I recommend recommend to my, I almost said
Absolutely.
patients, but my clients. But if there's anything just as a broad spectrum, that would be great overall for females.
Yeah, so broad spectrum, it's always a really good B complex. You tend to have a lot of your clients on that Thorne basic B, or the basic
Yes.
complex that has a good B complex in it already. So you guys kind of
Mm-hmm.
get that. If you're on that one, just making sure you're taking it, the full serving size, which I think is 2 a day.
Mm-hmm.
And so making sure you're getting plenty of B vitamins. And then, of course, as a broad spectrum, an adrenal formula. So whether it is an adrenal cortex or a combination herbal formula or both, depending on how severe the fatigue is, it's not necessarily always about just taking it first thing in the morning. And I think that's a really important thing, because we have to remember our circadian rhythm is through the whole day. So
Mm-hmm.
the biggest issue that I have with people is the dosing strategy of it all. It's always those adrenal formulas that are specifically meant for the adrenal gland should be dosed morning, midday. They should
Mm-hmm.
never just be dosed morning. So, and that's always the hardest thing. So I've encouraged people to utilize their personal PAs here and
Yes.
tell Siri and or whomever you may have, or Google, Google works really well as well. Just set a daily reminder that says, I have to take my pills at this time every day.
Mm-hmm.
And then eventually it starts becoming a habit.
Mm-hmm.
And that way, and then I always tell people, either keep a tin in your purse. They have those cute little metal tins that look like salve containers that I love at Sprouts, or just an
Mm-hmm.
old eye cream jar, however you want to do it. That's how my mom keeps hers. Cracks me up. Just a couple things that you can really, that you can at least keep a few things on board, so that when you're out
Mm-hmm.
in the middle of the day and you get that alarm, you can just pull it out and you're ready to go.
Yeah.
I think that's going to be the most important thing, is it's the dosing strategy, because you can take both things in the morning, but it's not going to serve you as well as if you can take it morning and midday. I encourage never taking stimulating things like adrenal cortex, for
Mm-hmm.
instance, after 3, because if you take it too late in the day, you actually sometimes can get overstimulated for bedtime. And we
Okay.
obviously do not want sleep to be affected. So that there's those couple things. And then if you're later stage, like your stage 2 or stage 3, then there's the upper root hormones that I really, really recommend, which is DHEA and pregnenolone. But dosing is really based on how fatigued you are. And so
Mm-hmm.
I recommend them, but it's just all about like starting really lightly, seeing how your body feels. They can be also overstimulating, but they can create so much positive clarity in your brain.
Mm-hmm.
That it also is really beautiful. And I've been recommending liquids recently over capsules. They just work better. So start with a
Yeah.
couple drops. So those
And
are
if
kind of
you,
the general.
okay, awesome. And if you work with me on nutrition, y'all know how I feel about the pill case. You probably have the link I've sent you with the fancy little pill case. It's got like, I think 4 little
Mm-hmm.
options for you to stick your pills. It can be tossed in your purse or your lunch bag or whatever. And I have an alarm on my phone, and it goes off at noon every day for my, one particular supplement as well. Super important. One thing I want to circle back to, 2 things. One is, I'm aware of what the circadian rhythm is, but I think
Mm-hmm.
maybe, can you just give us a brief as to what that is and why it's important?
Absolutely. So the circadian rhythm is our wake and sleep cycles. It's what wakes us up in the morning, preparing us for the day, and it's what allows us to prepare for sleep come sunset. And
Mm-hmm.
ideally, we used to, and I always remind people, like, this new modern world that we live in has only been around for 100 years. So there's still the
Exactly.
idea of adaptation. And if you think back, and you can even think back to the idea of the farming world if you'd like, but we used to wake up with the sunrise, because the sunrise, we didn't have all the blinds and blackout blinds that we have today that we can kind of coat things up. But we used to wake with the sunrise and then get ready for sleep with sunset. And that was our day, because we needed to live by the day. So our circadian rhythm was basically based on that thought processes. So
Mm-hmm.
bright lights wake us up, calming dim lights put us to sleep. And so our biggest issue today is that we have electricity. And I love it. And we're all very grateful, because then we have heaters, right? Especially right now, since it's gotten cold. But we have now too many lights. And so actually at bedtime, I encourage a lot of sleep hygiene,
Yeah.
so that you can actually encourage natural melatonin production, which was meant to start arising as the sun started setting. So the dimmer the light, the melatonin rises in our body, which is our sleep cycle production. And melatonin will not be produced if your eyes are getting too much light. So our computers, our phones, our tablets, if you read off any of those devices, stop, because it actually will affect the way you fall asleep and how effectively you make that melatonin. And a lot of people also don't like melatonin, and I actually love melatonin to help support the adrenal gland, because it's going to encourage that natural balance between the cortisol response. So,
okay.
Yeah. So just
makes perfect sense.
Circadian rhythms. Yeah.
I talk a lot, I geeked out for a while on sleep hygiene, and started reading, Sleep Smart, I think is by Sean Stevenson, which is a great book for those of you that are like, I sleep terribly. And I did quite a few things. I put like some plants in my room. I got blackout curtains. I have no electronics in my room. There's no TV. I don't fall asleep to the TV. I put my cell phone away from my head. Try not to be on electronics, 45 minutes to an hour prior to bed. I break that rule sometimes, but for the most part, but it's super important. And I will say it was a game changer for sleep and like waking up throughout the night. I know something else I wanted to check with you. I know we've got some questions going here in the chat box, and we'll totally circle back. So if you have questions, feel free to plug them in there. But I wanted to ask you, I know you're talking about stages like 1, 2, and 3. Can you give us a little bit of info as to what you're referring to on that? Because it's not familiar. Yeah.
It's not. And it's actually something I've started talking with more and more patients about, because I feel like if they understand where they are, they can understand the severity of the situation. So stage 1 is all fight or flight. It's all cortisol. It's all adrenaline. You're hyped up. You can make it through the day. You've got plenty of energy. You might also have a little bit more anxiety, like we talked about. And like I said, we mostly live our 20s, undergraduate, or, trying to figure out what we're doing in the world as adults in that fight or flight state, where maybe we're working 2 or 3 jobs, trying to figure out, what does life have for us? Stage 2, we call wired and tired. You cannot sleep at all, or you can sleep and then you wake up and you're like, I'm wired, I'm awake. Like, you wake up at 2 a.m. or you wake up every couple hours and you're just wide awake. A lot of women wake up around 3 and they just cannot fall back to sleep until 5, 6, or 7 in the morning. And sometimes they just go, well, this is my day, so I wake up now. So wired and tired is you have too much going on and you're exhausted the entire day. And then of course, stage 3 is just you're exhausted the entire day. You're cognitively declined. Memory seems to be a little bit more sluggish. Weight is definitely more of an issue. You think you have a hypothyroid issue. We all think thyroid issues at this point. I also talk with some people with stage 2 about a stage 2A and a stage 2B. And it's all about the way the cortisol curve works. And I've been doing a urine test more and more. And the urine test actually tells me you're not only where your DHEA pregnenolone levels are, which are those upper root hormones that feed to make cortisol, but they're also meant to make other hormones. Over time, those hormones actually start becoming depleted because cortisol keeps pulling in. Remember, you might have missed this, but cortisol will always play the winner. It will always take from any pathway necessary in the adrenal gland in order for survival, because you need cortisol for survival. You don't need progesterones for survival. So who cares how your menstrual cycles are? You don't need testosterone for survival. So who cares if you're feeling a little bit more weakness, or even though you keep working out over and over, your stamina can't come back. Your body doesn't care. Your body also doesn't care if you can reproduce. So maybe there's some fertility issues, or you had fertility issues, but it all cares about whether or not it can make this one hormone. So stage 2A and 2B are all about how is the curve itself. Does it wake well and fall down through the day well through the natural range? Or are you closer to the flat line? If you're closer to the cortisol flat line and DHEA and pregnenolone are either deficient or on the very low end, I call you stage 2B, just because you're almost at stage 3. Doctors are a little different on the A and B, but I've started using it more and more because there are different thoughts on each of the way the labs look. And then 3 is where you really have to focus on you in order to get out of bed. So, finally you become your priority. You're exhausted. So that's kind of the different stages in simplest terms. There's so many more different things that go into the hormones themselves, but they all tend to be really deficient, and cortisol is now very deficient. And that's where stage 3 really comes into play.
Okay, great. Thank you. That was super helpful for sure. I'm going to segue to another topic, and feel free, ladies. Everybody feel like this is good stuff? Thumbs up. I think this is great stuff. We'll go into the Q&A in the chat box in just a bit, but I want to make sure we touch on a few other questions that I'm finding are common themes amongst my clients. And I think I get often asked just as a general whole, like in the DMs and Instagram and Facebook, etc. I know as women, a lot of times when we hear testosterone, we associate that with being exclusively a male hormone. And I was guilty of this very early on. And until I started having some own personal issues with my hormones and my thyroid and getting all of that workup done. And also just learning and researching for myself. So I have a lot of clients who come in, they're training hard, their diet's on point, self-care is great, all these things, like all the check boxes for me are great. I'm like, what is going on, right? And, maybe 40s, approaching mid 40s, and just muscle tone isn't being developed. I'm pushing them, all the things are happening. And I tell them, maybe we need to take a look at your hormones. Your testosterone might be off. And I'm like, like, oh my gosh, no, I'm a female, And it was explained to me by Dr. Hunt. And she explained to me how they all work synergistically together. And if one is off, then, all these other things could be happening. So if you could share with my friends the importance of the role that testosterone plays as we are females, and why we need that, for fat loss, for, muscle preservation and all the things.
Absolutely. So muscle is one of our building hormones. Not only does it bring muscle strength and bone strength, which I think is really important as women move from their 40s into their 50s, where osteopenia and porosis are more of an issue, but it's also really important in mental strength and stamina.
Testosterone, right?
Testosterone, specifically testosterone. Testosterone is amazing for women that deal with a little bit more anxiety, because it gives a little bit more of mental strength to the body. And not only that, but it just kind of, to me, it's actually more of an uplifting hormone than even estrogen is. It makes you feel mentally stronger. And that's really hard to describe unless you've tried testosterone before. But when you're a doctor and you're trying to figure out how to talk to people about stuff, you sometimes try stuff on yourself because you don't really know how to give it out there until you've done it yourself. But really, I've tried really low doses of testosterone. And I think, let me talk about that. Male doses of testosterone require you be in the 700s, 800.
Right.
So yes, it is a very male hormone, and it's their primary hormone, where we have estrogen as our primary hormone. But it is one of our minor important hormones that, if not in a good range, can actually lead to a lot of physical stamina issues, muscle wasting syndromes, for women, especially moving into their 40s, because this is where hormones start attempting priority, because the signal is not as effective as it used to be when we were in our 20s and 30s. So testosterone levels can actually decline come perimenopause, and a common starting place that I give women are progesterone and testosterone, depending on how those values look. But for women, my goal is that their testosterone total be between, 30 and 60, right? As opposed to 600. So there's an appropriate place for women, but it all depends on application. And so there's so many different applications that we can utilize, that each labs might be slightly different. Like if I did a pellet on you, for instance, your testosterone might be 200 or 300 when we check your post pellet lab, but that's because we're now relying that the pellet lasts 3 months, 4 months, 6 months, depending on your natural metabolism. So if we don't get a decent peak at the beginning, you're living on the decline, basically, right? So if I get you to 100 and I want you naturally between 30 and 60, you're going to feel great for maybe a month, maybe 2 months. And it's all about your natural metabolism. But so testosterone is not one of those hormones that I think anyone should fear. but I think they should be aware that whoever they're working with know how to dose testosterone, because testosterone can be a pain in the butt. Anything has its max place on women. I have some women that need 5 milligrams a day, and I have another woman that needs 0.5 milligrams. So it's all about having the practitioner know dosing and how to start dosing, and but also be able to go, I'm noticing some acne. What do I do? And having the practitioner understand what the side effects of each hormone is based on when they dose, because everyone has their max point. Like there was I'm going to just bring this one up right now. I mean, melatonin for nightmares, that just means that you've overdosed your melatonin. A lot of people don't need 3 milligrams of melatonin, just like not a lot of people need 3 milligrams of testosterone. But so there's those you've had too much statements basically, and those are the side effects of it. So melatonin, nightmares, that's why you get them, by the way, Jill. But for women, it can be hair loss, acne, or a little bit more body odor smell. So it's all about finding the balance. And there's a woman who I've learned from for years now when I've been taking my trainings, and she basically calls it a hormone symphony. And if you think about a symphony, you know, with hormones, we have progesterone, cortisol, DHEA, testosterone, estradiol, thyroid, right? And if you think of this whole symphony, you know, you have the different areas of the orchestra, and you have the strings and the band side. And if they don't work in harmony, the orchestra sounds horrible, right? But if they have their director, they're doing beautifully. And then you feel great, and you notice that there's that good balance going on. So
yeah, that was essentially how it was explained to me. I mean, that was a great, very clear and distinct way to put it. That makes sense. And I will say, you know, I'm very transparent with most things. I think that's why a lot of people feel like they can come to me and ask questions, because I will be very honest, sometimes too honest. But, you know, I will speak to that, you know, having my hormones fixed essentially and my thyroid about 4 years ago, and being put on testosterone. And I was like afraid, like to tell anyone, like, oh my God, they're going to think I'm, you know, doing steroids. And I'm like, no, but look, I have a prescription. You know, like it's an effective amount. And, you know, working to find that balance again was the same thing. And I just wanted to quit because I was experiencing certain things. And then we finally, you know, found like a sweet spot. And now it's like, I haven't had to change anything. And it's been a great steady stream. But, you know, I do think a lot of times just as a whole, we like instant results, you know, you know, because everything is so instant. And I tell my clients, especially when I refer them to you, I'm like, great, let's give it about 3 months, and like things are going to start to look different. And like 3 months. And I'm like, you've been living with this for years. Like just patience for sure.
And I remind people that exact same thing. You spent the last 44 years making this situation take place. You got to give me at least 3 to 6 months to start doing my job. And the biggest issue, even with balancing hormones, especially if a cortisol issue is present, is that the adrenal gland takes a long time to recover, because you spent years putting it in a bit of disrepair. So when you're dealing with cortisol, I encourage people, you know, decrease severity and intensity of exercise, decrease intensity, especially like you can still stretch and do light exercise, but the intensity is the key. If I could send you all to a hotel on a beach for 6 months and you did nothing, there was no family, there was no responsibility. All you did was sleep, read, stretch, enjoy the sunlight. I mean, your adrenal gland would recover really beautifully.
Oh yeah. Let's go.
We all are still, right? I mean, how amazing would that be? But we all still live in our day-to-day life. So there's nothing I can do about the fact that you still live in your day-to-day life, except for encourage a little bit more priority on yourself and, you know, sleep. Give yourself time to actually fall asleep and stay asleep and prioritize that. Like if I could give you one thing to prevent any chronic disease would be prioritize sleep. There was actually a National Geographic article like 3 or 4 months ago talking about sleep and health. And it's amazing what happens if you have repetitive sleep disturbance, one leading to like things like breast cancer or different forms of cancer, but also other diseases like diabetes and hypertension. And so if you can prioritize anything, I mean, sleep would be the one thing I would encourage.
And this is perfect because this is the next direction I wanted to take this conversation, because
almost like I had the notes.
Yeah. You guys were totally riffing, by the way. Like I have, 5 questions, but I just wanted to make this super conversational based off of things that I see with clients. And then you guys have Q&A. But yeah, the importance of sleep. And, like I was mentioning, one of the questions that we ask in our check-ins with clients is like, how many hours of sleep are you getting? And I really try to, impress the stress of sleep upon my clients that like, I know at least for me personally, I'd love to hear your feedback. I try to get everybody at least at a minimum of 7 juicy hours of like solid sleep. More would be great. But 7, let's just strive for that 7. And I have some very like, strong-willed women, which I love because I am one of those. And they're just like, no days off, hardcore. I sleep 3 hours. I get all this stuff done. And I'm like, it's going to catch up to you.
Yep.
So can we talk a little bit about the importance of sleep in relation to our hormones? And then obviously that affects fat loss for sure.
Absolutely.
And hunger and metabolism and sex drive and like all the things.
Basically everything that you could think could go wrong in your body can be affected by sleep, which is the sad thing, because what we don't realize is we just think sleep is there as a part of our day. But what we don't realize, sleep is actually there for our recovery of the day, but also to naturally process the day. But there are some really important hormones that occur during our sleep cycles. Like T3 is actually more active in the night than it is in the day. So our natural T3 production is higher at night. So if we're not sleeping as effectively, our main hormone for metabolism, T3, is a really long name, so I just like abbreviating it, won't be used as functionally and effectively.
Which is our thyroid, correct?
Our thyroid, yes.
Okay, perfect.
Exactly. But it also, poor sleep can lead to insulin resistance. Insulin is, of course, the hormone that is supposed to put glucose into our cells for energy, to make energy, but it also makes fat cells. So if insulin resistance is an issue, it's probably started because of a sleep disorder over time. More insulin resistance means more glucose floating around in our body without a place to be. So eventually insulin just makes it into adipose or fat tissue. And again, another way to gain weight. And then the biggest one actually is growth hormone. So growth hormone release occurs between 2 and 4 a.m. depending on when you've fallen asleep. But growth hormone is basically everything you think it could be and more. It's our natural anti-inflammatory. It heals our bone and tissue. If we had an injury, that's going to be the time in which you're going to get the most benefit from recovery, is during sleep. Through that time frame, it's going to increase muscle stamina and strength and integrity, especially for people that are working out more. So if you don't have natural growth hormone release, you're actually going to be more inclined to not see the results that Diane is trying to get for you. And that's because you don't sleep and you don't prioritize it, actually. So growth hormone will not only do that, but it'll help with past injuries. I remember actually, once again, doctors try things for themselves so they can better understand. And we utilize a peptide called CJC with ipamorelin, and I was trying to figure out how to understand how it worked. And I have a really bad left hip and bad knee. And about 2 weeks in, I realized I was running, and I hate running. And
me too.
I hate running, but I feel like when I run, it's because you think about when you were younger and you could run just beautifully and swiftly and everything was great, right? Do we all remember that?
Yes.
Now,
yes. It just brought joy.
I know, right? It was fun. And now I feel clunky and heavy and a little uncoordinated, but I was walking my dog, and I was doing this run walk thing I like to do with her, where we sprint a block, we walk a block, we sprint a block, we walk a block, because I can't run as much as she needs, but that's what I can kind of do for her. And I was like, oh my God, I'm still running. And my knee felt amazing. And that's because I was having enhanced growth hormone release, because I also have issues with sleep. So I take things like melatonin to help with my sleeping cycles through the night. And that's because I'm stressed out. So I wake up at 2 to 3 a.m. depending on what's going on with work, right? So if I start doing that, I already have a sleep regimen set in line for myself that I implement. But it was actually really amazing, the natural release of growth hormone and what it can do for all of those types of things when it comes to your body. And that is only going to take place if you sleep. So, I mean, those are just 3 huge things that can happen with good sleep cycles. So if you can get 7 hours, I mean, I think you're doing great things, but I think people also need to prioritize it. For people that work later, there's yellow glasses. They're actually meant to block out the lights that can affect melatonin production. And so you can actually purchase those and look a little fancy at work or while you're doing your computer stuff. And you can buy them on Amazon, super inexpensive. So that's one thing that you can do to help if you just work in a situation where you can't avoid too much light, say at 9 p.m., 10 p.m., right? So
this also brings me to something that I also have to coach a lot of women in is the overuse of caffeine throughout the day, and how caffeine actually has lingering effects beyond the like little jolt it gives you. It has an afterlife, I believe it's called, correct? And I know personally for myself, I discovered this years ago, just reading and researching as well, but I will not do anything caffeinated, even like a diet soda, after 12. Because I had experimented and like 2 p.m. was too late. It was disrupting my sleep.
Yeah.
So I know we love ourselves some Starbucks, and we love to drive through when we have that energy crash at like 2 p.m., 3 p.m., grab your, lattes. But I highly encourage my clients, like, try to stick to decaf. And they're like, I can't, I got to get through the day. And I'm like, it's a perpetual cycle of like caffeine and crash. I need more caffeine because I'm crashing. And like, you're just never like, you could drink a pot and go right to bed, because at that point it's doing nothing. So you could give me your 2 cents on that.
Yeah. Well, I think a lot of it too is we all like our coffee a little bit differently. I think if we could be more accepting of Black coffee, which I'm not. So like, I don't expect a lot of people to do it. So it's better to not do it than do the Starbucks Super Trente multi-pump, whatever. Like, I don't speak Starbucks, but I have friends that do. And I'm like, I have no idea what you just said, but that sounds fancy.
I know.
But they have so much sugar. So the bigger issue is that you're not only living on the caffeinated high, which is also going to affect cortisol, you're living on the sugar high, which is going to affect glucose, right? So you're basically building both the adrenaline and the glucose response. So you get that like, oh, I feel great for 2 hours. And then you plummet. And once again, you're in that fatigue state. And so it only lasts a couple hours, and then you fall off that wagon. And over time, you're just basically stressing and draining the adrenal gland once again, because remember, this is the main hormone of the system. I feel like this is the one that we should always prioritize. But you're also affecting your natural insulin production and its functionality. So insulin resistance, which I didn't go into, is basically your little brother that's super annoying, and eventually you just don't hear him anymore. That's insulin resistance. It's you're not responding to the response that the body's been given. So insulin just is there, and it's attempting to do its job, but it's either nutritionally deficient, it gave up a long time ago because it just couldn't stand what you were doing to it. And eventually that's where glucose just keeps floating around and around. And that's then where we could become pre-diabetic and or diabetic. So that's insulin resistance. That's how I always think of it, as the little brother that's super annoying, or your sister.
And so again, one of the main reasons to, scale back the caffeine intake from a fat loss perspective, for sure. But I think too, even like just as, the boulder rolls downhill, it's like, it's not only affecting fat loss, it's affecting your sleep. So how these things are all intertwined, and then your sleep being affected is going to continue to affect your fat loss. You're just staying in this perpetual state of like fight or flight, and then cortisol. Absolutely. So it's all very much interweaved.
Absolutely. It's unfortunately a little bit too interweaved. I think we like to think that, our bodies are like our doctors. There's a pulmonologist, there's a cardiologist, and they're all very separate. And if you've ever been to one, you can tell that they only do that one thing. but that's not the way our body works. You know, we require our heart to pump our hormones around our body. We require healthy red blood cells to make sure that our hormones, you know, oxygen gets to the muscles. We require good protein in our blood so that that transportation vehicle can take place. It's like, think about the inner workings of any city. If one thing goes wrong, there's that jam, and then eventually the other, you know, a traffic jam one place because the lights are down or electricity went off, and then everything else around it starts becoming a little chaotic. You know, we're basically a city, and we don't think of our bodies that way. And I think that's the unfortunate thing, is we've been taught to very much separate a function, but it's, you know, one thing will lead to another thing. So adrenal fatigue will lead to thyroid dysfunction. Adrenal fatigue will actually lead to a low T3 syndrome due to thyroid issues. So low T3 is basically lack of conversion of T4 into T3, and that can be caused by a cortisol issue. Hormone imbalance can start due to environment issues, like you maybe have too many scents in your home and you really love Febreze because you have a young son, or, you know, you like scents in your home because you don't like the way things smell naturally, but those scents are actually making you more estrogenic. And we call those xenoestrogens. So it's like, and then eventually that estrogenicity is going to lead to your weight gain. So there's a lot of little things that can happen that can lead to bigger impacts in the body that we don't even realize can take place. So it's hard. This talk could go on all day, and we would
could be
not
a
even
6 hour. Yeah,
we would not cover everything.
For sure. And I knew, you know, I had selfishly the questions that I wanted to ask, that I knew as we started chatting, things would come up. But yes, I absolutely agree with you. And that's why I try to be a little bit of a detective, but like stay in my lane. Like I'm not a physician. So I'm like, ooh, not my scope of practice. Go here. Here's my therapist. Here's my doctor. Here's, you know, my body work person, you know, all the things. So super, super great. Thank you for that. I want to segue, since it's been about an hour, and I know this chat box will take us into probably another 30 minutes. Absolutely. So I want to get to some of these questions here. I'm really love talking about the effects of alcohol, as far as fat loss and multiple things. But the first one is, how long are the effects of alcohol impacting the body? Like, for example, how long does it take to work its way out?
I would say it's about natural movement and metabolism, but normally along the lines of 48 to 72 hours to fully kind of decrease the impact of the body on the body and the strain that it occurred or that caused the body to, you know, affect. So decreasing liver enzymes, helping with detoxification, and then of course your kidneys and your liver getting it out of the system. So I always say about 48 to 72 hours fully. And, you know, when we were younger, I don't know if you all noted that, you know, we were a lot more clean. You know, we just weren't around long enough. And so it was a lot faster. You could wake up and not have that lovely hangover. Now it's going to take longer as we get older, and it's moving more into like 48, 72 hours to really clean up from that impact. And it takes about 2 to 3 days to decrease sleep issues as well from that.
Right. And something else I did want to touch on too, because I do have a good significant portion of clients, some of who are here today, not going to mention any names, just a few that, you know, they're like, oh, I'm drinking 1 to 2 glasses a night. It helps me unwind. I put it in my macros, you know, I have a shot of this or whatever. And, you know, I notice working with them in the studio on how that affects things the next day for them. So for example, there's strength in the studio. They are groggy upon waking, honestly, even mood. You know, I'm pretty in tune with my clients, and I can see what you haven't eaten, or it's you drank last night, something's and, you know, I think we just disregard it a lot of times because we're so used to living in that state that we don't realize until we actually go, I hate to use the word cold turkey because I'm not like an extremist when it comes to things like that, but there is something to that, correct?
There is something to that. Absolutely. I mean, because again, alcohol consumption will affect your natural sleep cycle. And then of course, with just all the things we just talked about. So it's going to affect your insulin. It's going to affect your blood pressure. It's going to affect your cortisol production. It's going to affect your growth hormone release for the night of. So all of the things that were meant to repair have now just not taken place, we'll say. And so you wake up, your blood pressure is a little bit higher. Sometimes people feel it, sometimes they're not as in tune, but they feel like their heart is a little bit heavier. think that's a way to say it, where they feel like their heart, it's called a bounding heartbeat, but they feel it a little bit more strongly. So that's another thing that can take place. And of course, when you didn't get true sleep, you didn't go into that REM sleep cycle. You didn't get that deep, restful sleep that you were meant to get. And so of course, then you're waking up with more of what I call a sympathetic or fight or flight state. So your adrenaline is actually now amped up even more, trying to help make you, get through the day, basically, until you can either get a nap or, 8, 9 p.m. comes around the next day and you're just done with the rest of that day. So it actually is pretty detrimental to the body, especially if you're trying to clean up. It's nice. And I have actually been encouraging people to get like, a soda stream or like a AHAs or LaCroix and drink out of wine glasses and put like a little ounce of like palm juice.
Yeah. I tell them this, make it fancy, pretend.
Make it fancy. There's something about holding the wine glass, sitting down and like doing all the natural things you would do if you were drinking wine, but with something that looks wine-ish, you know? Right. And I actually encourage that quite a bit with people, because there's something about just holding the glass that can be mentally supportive and emotionally supportive. And so that is a really good way to not only get a good antioxidant with the palm, but, to pretend. There's a lot of, placebo that goes into medicine sometimes. And this is one that you should really take a part of. If you feel like your days are just too much and your anxiety is too high, then there's obviously really great things that can support anxiety to calm the body down and help you feel like you can take that deep breath that you're trying to get from the wine or the martini or the beer. But obviously there's healthier things that you can do than just that.
Right. It then becomes, tracing it back to like lifestyle and stress management. If you feel that you have to have the drink to then unwind or
it's a
relieve.
habit now. You guys have your drink at the end of the night and you guys sit and talk about whatever your day is consisted of. Either it's you and your roommate, depending on your age, or your husband, or, your significant other. Like it doesn't matter, but you just have to kind of change the atmosphere when it comes to alcohol consumption. And it's hard because not both significant others or partners or whomever might be on the same page. And so you see your significant other drinking, and you're like, well, I can have one. And one always leads to more than one, or one always leads to, I'll do it again the next day. And so it's all about that moderation. And I would say,
hard habit to break.
It is. I mean, it's a legal anxiolytic is really what it is. So, I mean, it's great to have every now and then and enjoy it once or twice a week, like you said. And I would say give yourself that one meal where you're allowed to have a little bit more than you were supposed to. That's probably not smart to say with all your group, right?
No, it's honestly exactly what I tell them too, is give yourself a budget. I just know, I tell clients, at least for myself personally, and what I've seen with working with my clients, is it's a gateway drug to snacking and staying up later. And then, it just, I know for myself personally, I had to completely cold turkey, and it's actually better for me if I do not, because one then leads to two, and I just know myself and it's never pretty. But, speaking to the changing of, from a wine to something else, just to have that hand to mouth, like stimulus that's like associated with drinking, is like, my thing is just ordering soda water from the bar. Like last night we went out for Amanda's bachelorette, and I'm like, they were like, you're not drinking. I'm like, no. and so, I got soda water with lime, and like, I had a sip of, I tested their drinks a little, and I was like, I'm good. Like, I don't need my own. And I felt great this morning, and I'm in a train, and like, it's not going to affect my day, and super happy about that. But
and that's smart. I mean, there's something about, you could do the soda water with a little bit of squeeze of lemon, lime, orange. I mean, that's the joys of bars, is they have all kinds of fun stuff. You can get mint muddled in. So like, there's things that you can do to make your drinks fancy without having the alcohol component of it. You have to be willing to be creative, like blend grapefruit in with some ice and soda water on top, and that's yummy, and so there's other ways to balance it out, like make a mojito without the sugar, basically, or and obviously alcohol. So that's been
Yeah.
my go-to recently is muddled mint. I have too much mint on my mint plan. So
Ooh,
I've been enjoying that.
it's good though. It's refreshing for sure.
Very refreshing.
Okay. I could talk about this forever. I'm super passionate about alcohol and its effects. Just, you know, coming from my own background with like knowing like, you know, family history of alcoholism and things like that, and how it's very easy for me to slide into that, you know. So it's helpful to have someone else that, you know, also confirms all that. So, okay. One message I got in a private question was, and this could be a super loaded topic, but I would say generally speaking, advice on regulating menstrual cycles, right? I know every female is going to be different. So you can't, it's very specific to the individual.
Absolutely.
But if you have like top 2 or 3 tips, generally speaking.
Regulating menstrual cycles. So I'll talk it in 2 terms that it presents to me. One is you don't have a normal menstrual cycle, meaning sometimes your cycle is 30 days, sometimes your cycle is 40 days. Those are considered abnormal cycles. And a lot of it is about trying to balance progesterone in that realm. So there are healthy nutrients that can enhance natural progesterone production. And that can help get you back into a normal cycle, meaning a 28 to 35 day cycle. And a cycle is day 1 of bleeding to basically the day before the next day you start bleeding. So it's all about the month itself, right? We'll say a natural cycle is every month. So there's progesterone, estrogen imbalance issues. A lot of the times we're estrogen dominant today. Estrogen dominance basically means you have too much estrogen to balance out how much progesterone your body has. Right. And is it that progesterone is being taken to make cortisol, or that you just don't naturally make enough cortisol, or you don't, you know, ovulate naturally or effectively? That's obviously the question that people ask me, and that's where labs come into play and learning your story a little bit more. But, you know, there's supporting progesterone, but also helping with estrogen elimination. So if you have heavier menstrual cycles, meaning you have very heavy flows, and this actually starts really occurring for women in their 40s when they start moving into perimenopause, which is the 5 to 10 year before menopause even takes place. But heavy menstrual cycles are basically a sign of estrogen dominance also. And so estrogen dominance, meaning how do we eliminate estrogens from our life that we have little control over? And that goes back to things like paying attention to xenoestrogen. So most likely you guys have already talked about, you know, avoiding plastic Tupperware when you're heating foods up, or make sure you're storing food in that's already hot. Like say you made a soup or a stew, or you have hot meats that are right out of the oven or stove. You don't put hot food in plastic. You're basically making a plastic tea, in a sense, is what I like. You don't put hot water in a plastic water bottle or a plastic container because you're making a plastic tea. So avoiding things that can affect your natural estrogen production. Other things, scents, I'm sorry to say, hair dye, makeup, the types of lotions you put on your body can be xenoestrogens, which is really sad because, I mean, there's some really fun stuff out there that is so bad for us. But, you know, knowing what those are is also really important. It's about half the battle making the change. So try and remove estrogens out of your life as much as you're able to, and then work on natural detoxification. So natural detoxification, because again, estrogen has to leave the body. We don't want to stop its natural production, but we might want to encourage it to leave more effectively. Healthy B vitamins are amazing. And then I like a product called DIM. DIM stands for diindolylmethane, but it's basically like eating a ton of cruciferous vegetables. If you can eat more cruciferous vegetables, right? Broccoli, cabbage, cauliflower, Brussels sprouts, to encourage better detoxification. Again, all those things I said are vegetables, right? So if you can eat more vegetables, you're going to encourage those pathways to work more effectively. And over time, normally 2 to 3 cycles, when you start making a change, is it takes to affect and impact the cycle itself. So you got to give yourself also a couple months, again, 3 to 6 months to make change in the body, because the body, you know, renews itself every few months depending on the organ system. So, you know, those are some things that you can do to regulate menstrual cycle, but you have to also determine, you know, estrogen itself. Estrogen is that key component that can really play lots of tricks on people.
This is super helpful. I'm definitely guilty of the Tupperware life.
Well, and you can
So,
use Tupperware, just let things naturally cool down in your pan so that they're actually cold, not like lukewarm, because
mhm.
that's an issue. So, and if you store stuff in Tupperware, it's not a bad thing. Say you're a meal prepper and you've got those really fancy meal prep containers that are all plastic, just put it on another plate when you warm it up for eating. You just got to try your best to avoid those plastics. And I tell people Costco has hydro flasks, 2 hydro flasks for like $18, like great water bottles. One, but I mean, every now and then we're going to go on a trip and we're going to need to buy a gallon of water. That's fine, but save those instances for the times when they're truly necessary. Do not make a habit out of buying those big 16-ounce packs of water and that's your water for the week, you know?
Mhm.
But again, I'm sure that's already your go-to as well. I've seen your ladies with your
Definitely.
big water bottles.
Yeah, yeah. I'm guilty of the jug life, with my water jug,
Mm-hmm.
because refilling my hydro flask at the studio a couple times is a little bit of a challenge, but
Mm-hmm.
something I'm going to be aware of for sure, a little more now. Just I'm always like trying to level up my like human optimization. That's what I call it.
Mm-hmm.
Like, I'm still on it for those of you that are familiar with that brand, that supplement brand,
Oh,
but
I love that brand,
yeah, me too.
which is so upsetting because their marketing is
I
I
know.
wanted to carry their line in our office and they're a bit too expensive to carry in office.
Yeah, yeah, but human optimization. So for sure,
Mm-hmm.
I'm already taking away some fun little tweaks that I'm going to add for myself too.
Yeah.
Um, I know I did get a private question about which I'm sad to say this out loud, but I did hear that like you might not be taking new clients. But someone said like, hey, what do I need to do with start sessions with her? I was going to wait till the end for this, but it's like,
Mm-hmm.
it's in the chat box. So I just want to like knock that out so I don't forget it. But we'll
There's
have contact info.
yeah, definitely. Diane knows how to reach me at both of the facilities I work for. I do take new clients um, monthly, but I'm definitely going to stop taking them for a couple months. And every couple months, I stop taking new clients just because I try and balance out the people I'm already working with, depending on what my
Yes.
schedule looks like. So it's all about that. But the great thing is I have a colleague and his name is Dr. Wallace. And yes, he is a male, but he hears it every day, just like I do. And
Mm-hmm.
he is just as good, if not better than I am when it comes to hormones. I think the only thing that I've got on him is that I have them. And so there's a personal understanding of experience, but he lives with me considering he's my husband. So there's a lot of interchange. Like I have a patient or he has a patient and we're just like, okay, well, the hormones we're giving you or that patient is not working. What am I missing? And I think that's the joys of colleagues is so even if you're not seeing me in person personally or via telemedicine, because this is actually the application I use for telemedicine. So this is the face you see when you do appointments with me via telemedicine. You're still going to get amazing care. And you're
Mm-hmm.
still going to probably get some of my care because we talk about clients all the time together, or we talk about how do we encourage this person to sleep better, or what am I missing when it comes to this person's sleep cycle. So doctors talk with other doctors a lot about different cases if they're more difficult or there's a lot more stress leading up and it's not just one thing. That's the joys of depending on the fatigue state of the body is it's more than just one hormone that we have to look at, right? So it's like, how do you start and implement those programs? But I am taking new clients currently. So I think I'm booked until December at this point, which is not too shabby because we're in November, but I have a couple new clients personally at my private clinic available. And then I don't think for Valley Wellness, they're later just because they're busier.
Another thing I wanted to mention too, I think, when I was originally referring clients to you before quarantine, I had kind of started, a lot of people were like, oh, I don't know, telemedicine, like they want that face-to-face. And I'm like,
absolutely.
Most of the visit is she doesn't need to like, yes, your vitals are important, right? Like your heart rate, your blood pressure, et cetera. But this is a whole nother, this is an up level of medicine, right?
Correct.
Yeah.
If you get the information from me like this and you can see me and I move my hands all the time. So I'll tell you I'm that hand talker person. I joke around a little too much sometimes, but like you'll get my personality quite nicely if you're comfortable with Zoom, and you guys all logged in really beautifully. So I prefer telemedicine because the issue is that I see people not only in California and Arizona, I have patients in Texas and Georgia and Oregon and Idaho. So the telemedicine application has really worked for my private clinic beautifully. And my front desk is awesome. I've been training her for years to know how to instruct people and troubleshoot the Zoom world. We used to use another application before, but Zoom has just worked really beautifully with the charting system we use. And so it's like there's literally a check-in button in your appointments tab in your portal. So it works quite lovely. You check in, Zoom pops up, you either download it or you have it already, and then we get to talk. So it's
awesome.
You're totally right. I'm not your primary. If I need to do something for you, I'm licensed in multiple states. So if I have to run an ultrasound, for instance, because I think you might have cysts, I'm just going to run an ultrasound for you. So I have full prescribing rights in multiple states at this point. So it's like I can still do quite a bit without having to touch your belly or listen to your heart. And that's not my job at this point, because I've kind of taken myself away from the primary world and put myself more into the female wellness world.
Absolutely. And that's why I love it. It's awesome. Okay. I want to be respectful of everybody's time. I know we've already about an hour and 15 in, which is great because this is super juicy. I'm so engaged in all the info, but what one supplement would you recommend for cortisol? I'm just going to kind of create a little brevity around some of these questions. So like go-to supplement, women over 40, cortisol is an issue. Obviously lifestyle things we're going to assume are on the works, but what would you recommend?
Probably an Adrenal Cortex product that has B5 and vitamin C in it.
Okay.
Like it has to have those couple nutrients in it, or at least take a B. I can't do one. I can't. I'm impossible.
I know. I'm like, the same way too. I'm like, one thing. So I can't give you one thing.
A good multi and the cortisol product, and then take it morning and midday. You can take the multi all at once. I'm fine with that, just because they're all going to work through the day. But make sure you take the morning and midday dose. Like I can't stress that enough. Like that, that's your afternoon coffee right there. If you take your adrenal product properly.
Okay. And then to piggyback on that, supplement as far as hot flashes goes. I know black cohosh was one that was like widely used.
Black cohosh is hugely used. There's a couple really good menopause formulas out there. I use one by a company called Vitanica. If I need to find one specifically, it's like, I think it's called menopause phase 1 or something like that, but it basically has dong quai, black cohosh, wild yam, vitex. So you're going to look at something that has a combination of those herbs. And then of course, the biggest issue is herbs are amazing, but herbs can only do so much for so long. And then eventually you have to be realistic and go, okay, well, my estrogen, progesterone are definitely off right now. So I might need the real thing. Right. The other thing is you can get progesterone over the counter, but a lot of people take it really inappropriately. And I have to like fix what a lot of people read online. And so with progesterone, if you cycle, take it at bedtime and then take it like days 14 through 27 or 28 of your cycle, depending on the length of your cycle. If you don't have an app, get an app. It'll tell you what your cycle is. Again, day 1 of your cycle is always day 1 of bleeding. So you just count forward 1, 2, 3, and you'll know what day 13 is. And then it's a calmer. Progesterone is amazing, but it's all about finding the balance. I have a lot of women that get hot flashes because they don't have enough progesterone. So it's a hard thing. I actually offer labs to people without having to see me through a company called Ulta Labs. And I can give you the link if people just want to look at their panels. So you basically just log in and go to Quest and get your blood drawn. You pay cash, so you don't have to see anybody. And you can just go, okay, what do my labs say to me? And obviously then you just have a professional interpret them, or go, wow, my estrogen is really, really high and my progesterone is really low.
Yeah. And I think that's incredibly empowering. You know, I worked in the medical field for a decade and, you know, not on the preventative medicine side of things, but it was, you know, interesting once I left that world to see how you know, we put so much in traditional medicine without allowing ourselves to have some autonomy over our health care and like our own personal, you know, our own personal strategies for wellness.
Absolutely.
And getting wellness under control before we have to see, you know, your doctor for these issues. So I'm a huge advocate. People are like, oh my gosh, you take so many supplements, et cetera, et cetera. I'm like, because it's unrealistic to think that I'm getting all these things from my foods. You know, we live in a totally different day and age where, you know, electronics, stressors, all the things that we've been discussing. So I would much rather take something that's safer, gentler than, you know, acclimating to harsh drugs with, you know, tons of side effects.
Well, and I think it's also great to know that your own practitioners like myself, I take like 6 different supplements a day. And then I have my weekly ones. Like I have my vitamin D that I dose out weekly. I take vitamin E a couple times a week. I do carnitine a few times a week because I'm more of a vegetarian versus a full-on meat eater. So, you know, carnitine is necessary. I make sure I take my B vitamins every day to handle my stress management. So there are purposes for all the what you think is a lot of pill popping, you know, but really, I mean, if you lived in an ideal world and you had all these helping hands and all you had to do is wake up and take your kids to school and then pick them up at the end of the day and you had no other responsibilities or work or food to make, well, then you probably don't need a ton. Like you need a basic multi and maybe a fish oil, right? But that's not the world we live in today.
No.
And how I would love that sometimes. I'm like, man, how did we do this 100 years ago without all this excess text messaging and stuff?
No, and constantly being a slave to, you know, response and just notifications for sure.
Yes.
And then quickly, Adrenal Cortex, is there a specific brand that you recommend? And you said to take AM and then also
midday lunches. Yeah. If you do lunch, obviously, if not between 12 and 1 is what I encourage. Depending on when you get that afternoon fatigue. I am definitely a supplement snob.
I will, as you should be. It goes in your body. I tell my clients all the time.
Well, it's also like, there's articles out there that if you purchase supplements from like Target and Walmart or the basic general drugstores, they're not giving you what they say they are. So there might be a little bit of that product in it, but it's not the dose in which they've indicated. And then everybody's so different. If we're being so generalized, we want to make sure that we're getting good active B vitamins. So if you get a B vitamin, for instance, from a generalized drugstore and you look on it and it says cyanocobalamin as your B12 form, I mean, you're literally getting a synthetic B12 attached to a cyanide molecule. Like, who wants that in their body? And they don't even realize that. So I will always go for physician formulations. Dan carries Thorne products a lot. And that company is amazing. Like Thorne was probably at the forefront of research in supplements and high quality supplements before I even went into medical school. They
took me forever to find them.
Yeah. And they're not inexpensive, but if you think about it, you're paying for the quality. So think about meat, you know, you're going to pay more for a filet mignon because it's a more appropriate, healthy, it's got great, you know, juiciness and it's awesome, right? You're going to pay more for that per pound than you are going to get like flank steak. You're going to pay more for a specific car than you're going to pay for another car, specific clothes brands. And it's more about the quality. It's not just about it's on what they say is in there, but it's about the sources that they're getting are clean sources, because you can get sources from anywhere. And the last thing you want to find out is the company that you're getting product from is from, you know, China or Indonesia or India, where we don't know where they're getting their stuff from because they have less regulation. So I am definitely into physician formulations. There's a couple over-the-counter products that I like I like Now Foods. It's a bright orange bottle. I like a Renewed Life, which is a probiotic company. They have great probiotics. I like Jarrow. So like those are just generalized, and some Source Naturals products, like I like their immune formula, the wellness formula. So, but those are like my go-tos if I send someone to Sprouts.
Okay, cool.
So like, good. But other than that, like pay attention to your sourcing.
For sure. Super important. I always tell clients like, you know, if you're more concerned about carrying a fancy, expensive handbag and you're just scoffing at me for telling you that you have to spend a little more on your supplements, we need to talk.
Yeah. I would much rather have really expensive supplements than pretty shoes. Like I'll get my shoes at Target. I'm cool with that.
Yeah, exactly. Exactly. And then melatonin is to be taken at night. I want to just clarify that, correct?
Absolutely. So
Yes.
melatonin is dosed based on your sleep cycle. Do you have issues falling asleep or do you have issues staying asleep? So if you have issues falling asleep, you should take melatonin at least 45 minutes to an hour and a half before bed. If you have issues staying asleep, then at bedtime is perfect. I recommend the sustained release melatonin over a rapid release because then it's slowly releasing through the night, encouraging natural production versus just really, really high potency and then dropping in the body. And then you still wake up at 2 a.m. So that plays a really good role.
Okay. And then L-theanine, thoughts?
Oh, I love theanine. It's my favorite go-to for anxiety. It's actually one of the things that I was kind of thinking about when we were talking about the alcohol conversation and people need to go home and take a natural anxiolytic. It's a byproduct of green tea. Like, I mean, so you can't get really any healthier than that, most green teas, but it's just, I describe it as it allows you to feel like you can take a little bit more of a deep breath, and it's a little dose dependent. If you do 100 milligrams, I feel like you can make it through the day a little bit more effectively if you have anxiety. If you do it at bedtime, I recommend 200 milligrams because 200 is going to help calm the mind and mental activity down. And so mixing melatonin and theanine, I think, are great. I do love that. I mean, and awesome. That's one of the things I take personally if I go through phases of high stress and I can't fall asleep or stay asleep. So it's my go-to.
Might have to start adding that in. Another question, and I think when I start working with nutrition clients initially, and I give them a baseline, like, and there's like probiotics, a great multivitamin, et cetera, as just like this is where we're starting. And then based off of our time together over the course of 12 weeks, and you answer the questions, and then I go, okay, let's add this, or let's try this. I get a little pushback and resistance, which is understandable, right? This is your body. You have questions. I respect that.
Absolutely.
Too many supplements harmful to our liver? How many are too much? I feel like I know the answer to this, but you go ahead and take the floor.
I think it's hard to say. So I have people that I meet and they come in and they're taking like 30 supplements. Like that is to me just ridiculous. There's no reason that you should be taking 30 individual supplements at all. So a lot of the times I can kind of clean that up and pull it in. I think like less than 10 is ideal. But like for me, it's also about like, how's your weekly regimen? Like, so I take vitamin D and vitamin E multiple times a week, or, I take vitamin D every Monday. I take a big dropper full of my liquid vitamin D to keep my vitamin D up. So that's my 1 a week dose. So on that day, I take more vitamins, right? And some days I take less because it's just my normal routine. And my normal routine consists of a multi, CoQ10, a fish oil, magnesium, and there's a couple like melatonin at bedtime. So like there's a bunch of other things that I take, but it's all through the day. And I think it's also about how frequently you're taking them. So you can take, if you're taking handfuls at one point in time, maybe you're taking too much and you need to learn to split it up again. And then those pill boxes, we think about our grandparents that used to have them because they had all their pills, but remember those were all pharmaceuticals. So these are all preventing you from taking the pharmaceuticals, and that's the goal of them. So look at it as a shining star, as opposed to going, oh my God, I'm causing so many more detrimental effects in my body thanks to side effects of lisinopril for your blood pressure or whatever. So
I think just to touch on that, I think because the good old age of marketing, and you watch a lot of TV and you see like the commercial for, I'm just going to say because it's top of mind, like Zoloft, and then may cause diarrhea, mood change, hair growth, all these things. And then if you've never taken supplements, I think the standard is to automatically assume that the link of the two is like, oh, that this is going to happen too when I start taking supplements. And it's like, that's the exact opposite, in most cases, for sure.
Yeah. And ideally that's preventing you from needing to take all those pills with all those side effects.
For sure.
The one thing I'll say is that you do have to be conscientious of where you get your products. Like get it from someone that knows what they're doing. And not all MLM companies know what they're doing. So knowing that you're getting a good source is just as important as knowing you're drinking healthy filtered water, right? Like you can still get toxins in them. I don't know if you guys all see that Prop 65 that's on all of your supplements for the majority. And that's because that link says it can cause cancer or it can be harmful to health. Well, a lot of them can be because they might not be coming from a healthy source. And some people can get chemical sources and heavy metal sources from supplements because they're not getting them from good locations. So like of the things to be a snob about your supplements, right?
For sure.
Purses can come and go, but be a snob about supplements.
Yes. I'm going to start just kind of cherry picking some of the questions here just for the sake of time. But one that I did get privately that I feel like is important, I think would be great to just get some feedback on is the things that like we had touched on earlier in the conversation is around the time of your period where like, and I can ding, 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 100% relate to what you said, where you're like, oh, you feel like a different person. And like, you just feel super disconnected. Like my mood goes haywire. And then, you get, you get the period poops. Okay. Like it's a thing, right? Where like all of a sudden your digestion is weird and you're bloated. And the mood and all the things, is there something, obviously hormones, we have to, let's say that those are pretty well managed. Is there something supplement wise that will assist in that not being so intense?
The digestion itself?
Yeah, just all the things like bloating, mood, usually I refer to like evening primrose oil sometimes helps with that as well.
Evening primrose oil is great because it helps balance estrogen out, right? So that's why we give it. Not only is it a fatty acid, which helps build the natural pathway, because cholesterol, right? We all have this cholesterol is a bad thing thanks to our medical community, but cholesterol is actually the precursor to every single hormone we've talked about today. So it's a precursor to progesterone. So it makes progesterone, basically. It makes testosterone, it makes estrogen, and it makes cortisol. So it's not only evening primrose amazing at balancing estrogen, but it balances the pathway out as well because it's feeding it. So it actually works in a lot of different arenas for that. So evening primrose is really great, but I also encourage a really good digestive enzyme at that point in time because when estrogen and progesterone are in chaos, estrogen also affects the way our digestion works, hence the gas and the bloating. There are estrogen receptors in our digestive system, which a lot of people don't realize, and it can affect how well digestion takes place. So if we feel like we're getting a lot more gas and bloating or belching and reflux, that's because estrogen is affecting that in a negative manner versus a positive manner. So a good digestive enzymes, I mean, evening primrose is a beautiful go-to. There is a supplement that we carry at the Valley Wellness office called, it's a Yes Omega EFA. I always just deem it Yes Omega or Yes EFA on people's treatment sheets. And it's got evening primrose oil, coconut oil, flaxseed oil. And those are my two favorite, evening primrose and flaxseed oil. Like flaxseed is huge for estrogen balance. And it just feeds those pathways so beautifully. And it's oil, not a like meal, although the meal is great for fiber, but the oil itself, which not everybody loves the taste, but if you take capsules, you have to take way too much. So a tablespoon of like Barlean's flaxseed oil, the organic company, is my go-to. Get that at Sprouts. A tablespoon a day will make such an amazing difference and too much for a lot of your hormone imbalance with a good multivitamin. It's actually kind of crazy how something so simple can be such a huge whirlwind for that PMS phase. And that's normally 7 to 10 days before the period starts. And it actually is because your estrogen progesterone ratios are off. And that's normally a progesterone deficiency issue. Now there's 3 estrogen dominances: too much estrogen, normal progesterone, normal estrogen, low progesterone, right? And then there's too high of one, too low of the other in the normal range. So there's a lot of possibilities. So something general like that works really beautiful because it can create better balance.
Yeah, I usually recommend, because I know I do this for myself and it was a game changer. And my daughter as well, we both have the very similar symptoms around our period. And I know I always recommend for my clients is that we increase the evening Primrose Oil dosage about 7 days prior to our period. And then while I'm on my cycle as well. And that has been very, very helpful. Very helpful.
Very cool. Yeah. There's a lot of different ways that I've seen people dose certain supplements, and it's always learning. You always learn from other people.
Yeah.
So
yeah. And then real quick, Lucy had asked if you were local, if you're taking new clients, which we did talk about earlier. I will send this is being recorded, so I'll send a link to the video and also all of Dr. Sundermeyer's resources for those of you that are interested, and then you can connect with her. If you did get my email earlier in the week when I was asking, girls who are interested to register, I believe there is a link to her website there. So if you want to dig up that email in your inbox, you can certainly find it there if you are in a rush, because I'll try to get this out tomorrow. Okay, let me see. We're about at 90 minutes right now, but one more thing I want to ask, and then we'll wrap it up. Oh gosh, there's so many good ones. I'm asking this selfishly because one person did ask it, but it also for me as a coach to help women who work night shift, and it has affected their sleep cycles, their hunger, their everything, their circadian rhythm is completely off. Is there some sort of regimen or checklist or anything advice wise that you usually go to for your night workers?
Yeah, so I actually just reverse a natural adrenal program. So their morning, they will take the adrenal formula in the morning, and then midday, whenever their shift is. And then I actually recommend phosphatidylserine at their natural bedtime. So phosphatidylserine is amazing because it actually gives your cortisol a ceiling. It's like the best one to do that. So your cortisol is actually encouraged to calm down. And so you're trying to basically flip your natural circadian rhythm when you work at night. And it's not easy to do, I'll be totally honest, because you guys tend to live at the night for your work, and then you have your days where you live in the day. And that's what makes it really difficult, because you have some days where you're a night and some days where you're a day person. And that's where it gets a little tricky. But I always encourage flipping the cortisol supplement regimen to, your morning like you naturally would, midday like you naturally would, and then encourage the phosphatidylserine. I think you have people on a powder I've seen. I don't know what it's called off the top of my head. Yeah. So that one is beautiful at bedtime to not only calm the natural cortisol response that you have if you get that lovely second wind or that 3 a.m. wake up call, but it's great for shifting that curve down at night as well. And so that is one thing that I would encourage. And then progesterone at bedtime via capsule, just to support better sleep cycles. So those would be the go-to things. And then melatonin, right? And if you get nightmares at 3 milligrams, I would get a liquid and start dosing at 0.5 milligram increments and see how you do.
Okay. And then I know I said last question, but evening Primrose Oil, is there a general standard that you usually recommend? If you're going to take just a standard dose every day?
500 to 1,000 is a good goal. I always say start low and give yourself a week or two, see how you feel, and then you can always double your dose. And then you can kind of really decide. And the thing is, when you're dosing yourself, start low. Don't start at 100%, because everyone's a little bit different and you're not being guided through it based on your blood work and based on what information someone like me, encouraged for you. So start with a half a dose and then slowly build up to a full dose and find your sweet spot.
Perfect. Yeah. Oh my gosh, this was so juicy. You guys, how do we feel? Did we like this? I mean, nobody left. Usually Zoom will give me a little chime to say XYZ person left, and everybody stayed. So this was great.
I'm glad this worked.
Yeah.
There's a couple other questions that I know we didn't get to, but if it's artificial, it's not good for you. Try monk fruit and stevia are my go-tos. Cold flashes, adrenal, and thyroid. Somebody spelled theanine already for someone. And so those are two that I wanted to make sure. I am not a fan of most MLMs, and there's one that I do like, and I do not recall the name. I think it's Isogenics.
So for those that don't know what MLM is a multi-level marketing company, and some of them are great. I'm
Some of them
not
are
a
amazing.
fan.
Like
Yeah.
longevity is another really good one, but not all. The issue is not every company has one, like 100% good products.
For
And
sure.
that's also the very big issue. So we're trying to private label, and between myself and Dr. Wallace, who's again my significant other, we can't decide on one company because not one company gives us everything we need.
Right.
And so, it's hard to say you can just follow one MLM's regimen, but like, I don't like Melaleuca. I don't like doTERRA. I don't like Young Living. Like those are the hard ones. Essential oils, be careful with the manufacture process. Some chemically dilute them or make the distillate, and then you're basically still getting heavy metals in them. That's another one I saw. So
okay.
And candles are not good because they're artificially flavored or artificially scented. So diffusers and essential oils are go-to. You guys got to stop asking questions.
I know, right? We'll just keep going. Going. No,
absolutely.
But this was really great. Thank you so much for your time. I know you just totally did this pro bono, but like
absolutely.
I think this all is cool. About just my clients, my community, helping them just create awareness around other possibilities. I know, a lot of times we're just very, this is the way, and this is the way it's always been done. And anything out of the norm is a little scary. And so I wanted to make it very understandable, and hopefully everybody took away at least one little nugget of something that maybe will help them.
Absolutely.
In their health.
And I will tell you that you ask your conventional doctor about this, and you are going to get a lot of unusual looks, and just know that's not real medicine. And that's why people like me do exist, is that this is because you've already gone to see your, the endocrinologist, and you've already gone to see your primary care doctor, and their sole answer is birth control for you, because that's what they think is the go-to, and that is their go-to. You have acne, here's birth control. You have an abnormal menstrual cycle, here's birth control. You have PCOS, here's birth control. You have depression around your cycle, here's birth control. So it is not the cure-all, and it can actually lead to things like breast cancer, because they're not appropriately chemically the same hormones. So it's nice that people like me exist, and there are a lot more than just me out there. So, I mean, it's just look for an integrative doctor that has been focusing on hormones as well. So, depending on your location.
Yeah, I think that you touched on another great topic that we may need to visit eventually down the line. I just put Dr. Sundermeyer's link in there, everybody. So in the chat box, if you want to just open up a browser real quick and check out her site and book a consultation, you're more than welcome to do that there before I turn Zoom off, because then it'll disappear, but just wanted to plug that in there. But yes, birth control hormones greatly affect all the things. And I think having a skilled professional in female hormone health that can, get you off hormones, and maybe, or get you off birth control, or give some alternatives to that, are very, very helpful in all the things.
Absolutely.
Okay, so there's the other link.
There's two websites. We actually created a new one when we went to integrative telemedicine. And so it just kind of talks a little bit more about our telemedicine platform as well. And then, of course, all of you are aware that intermittently I am local at Valley Wellness Center. So there's that too. If you have to have me in person, which I personally think I'm fancy either way. So the only difference is you do not get to shake my hand, but you still get to see my ridiculous gestures and hand movements. So it works great either way.
It's perfect. If they're here because of me, they are fine with the hand gestures. Okay.
Well, and the one thing I think about internet, and I'll just kind of segue out with this, is that I can share my screen with you just as easily as I can show you my screen in our appointment. So I show charts and graphs, and my mouse is moving all over the place. So you're seeing what I'm talking about, because sometimes visuals, I've always been a visual learner. So I struggled in school sometimes because it was somebody write it, show me what this means that you're trying to describe to me.
Yeah.
So I'm a big proponent of graphs and charts and images. And I love showing that to my clients, because I think it's really helpful to understand the phases of the menstrual cycle, the adrenal pathways and all of that. And so you can go, oh my God, there's so much more to it than I even realized. And we barely hit on things today. So,
I mean, just scratch the surface.
scratch the surface.
Yeah. And I think what's been refreshing, at least feedback from my clients who I've referred, is like, oh my gosh, she spent an hour with me. I'm like, that's because there's a lot of things that have to be uncovered. It's not just like problem. Okay, medicine, here you go. Bye. Go to the pharmacy, you know, and like shoo, your insurance gives me 15 minutes, you know.
Correct.
It's
and even
definitely
that is not
experience.
with the full doctor. When you're with insurance, it's your MA coming in and triaging you, and then the doctor goes, cool, so this is your issue, tell me a little bit about that. All right, let me pretend I felt your thyroid and listen to your heart really briefly, and then you're done. And that's where medicine has gone to.
So okay, parting words. This is the only body that you get. It's the only house you have to live in. So make sure you're taking care of it appropriately, you know, do your diligent research, be an advocate for yourself and your self-care. And, you know, thank you again. That was super awesome. And you guys, thank you for spending your Sunday with us. Yes. Hopefully you took some things away. Like I said, I will reshoot the recording over to you in your inbox tomorrow. If you had to miss some of it in the beginning, there was some juicy stuff there too. So, so thank you all very much. And thank you, Dr. Sundermeyer.
Thank you, ladies, for your time this morning. I know I ramble sometimes, but this is also my personality.
Yeah, no, it was great. It was great.
I hope you guys have a beautiful rest of your Sunday. Absolutely.
You too. All right. Bye, you guys.
Bye.
Bye.